Question 1. Analysis of a veteran presenting with symptoms of anxiety and sleep disturbances, who expresses reluctance to discuss their combat experiences due to a fear of being perceived as weak, requires a professional to employ a decision-making framework that balances therapeutic alliance building with appropriate intervention. Which of the following approaches best reflects best professional practice in this situation? Option A. Immediately inquire about specific combat incidents to determine if there is a duty to warn or report, prioritizing legal compliance over immediate therapeutic rapport. Option B. Advise the veteran that discussing combat experiences is necessary for treatment and that withholding information will hinder progress, potentially leading to a referral for mandatory reporting. Option C. Provide general stress management techniques without delving into the specifics of their military service, assuming their reluctance indicates a desire to move past those experiences. Option D. Initiate a detailed assessment of potential military-related trauma, focusing on building rapport and exploring coping mechanisms before considering any specific reporting obligations. Correct answer is D. Initiate a detailed assessment of potential military-related trauma, focusing on building rapport and exploring coping mechanisms before considering any specific reporting obligations. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a veteran experiencing significant psychological distress, potentially linked to their military service, and the professional must navigate complex ethical considerations regarding confidentiality, duty to warn, and the provision of appropriate care within the scope of their practice. The veteran's reluctance to disclose specific details due to perceived stigma or fear of repercussions adds another layer of difficulty, requiring a delicate balance between building trust and ensuring safety. Correct approach analysis. The correct approach prioritizes a comprehensive, trauma-informed assessment that respects the veteran's autonomy and builds rapport. This involves actively listening, validating their experiences, and collaboratively developing a treatment plan. This aligns with ethical guidelines for mental health professionals, which emphasize client-centered care, informed consent, and the principle of beneficence, acting in the client's best interest. Specifically, it adheres to the ethical imperative to understand the unique stressors and potential trauma exposures faced by military personnel and veterans, such as combat exposure, deployment-related stress, and the challenges of reintegration. The focus on building trust and exploring coping mechanisms is crucial for effective trauma treatment. Incorrect approaches analysis. An approach that immediately focuses on mandated reporting without a thorough assessment fails to establish trust and may alienate the veteran, hindering their willingness to seek further help. This could violate ethical principles of non-maleficence, avoiding harm, by potentially causing further distress and damaging the therapeutic alliance. It also overlooks the importance of a nuanced understanding of trauma, where immediate reporting might not be warranted or even appropriate if the disclosed information does not meet the threshold for a duty to warn or report. An approach that dismisses the veteran's concerns as simply adjustment issues, without a deeper exploration of potential trauma, is a significant ethical failure. This demonstrates a lack of cultural competence and a failure to recognize the specific impact of military service on mental health. It violates the principle of justice by potentially providing substandard care based on prejudice or ignorance. Such an approach can lead to misdiagnosis and ineffective treatment, further exacerbating the veteran's suffering. An approach that solely relies on generic, non-trauma-informed interventions without acknowledging the potential military-related trauma is also professionally inadequate. While general coping strategies can be helpful, they may not address the root causes of the veteran's distress. This approach fails to meet the standard of care for individuals with a history of trauma, particularly military trauma, and can be seen as a breach of competence and diligence. Professional reasoning. Professionals should employ a decision-making framework that begins with establishing a safe and trusting therapeutic environment. This involves active listening, empathy, and a commitment to understanding the client's unique experiences, especially those related to military service. The next step is a comprehensive assessment that explores the nature and impact of potential trauma, considering military-specific stressors. This assessment should inform a collaborative treatment planning process, where the veteran is an active participant. Throughout this process, professionals must remain aware of their ethical obligations, including confidentiality and the duty to warn, applying these principles judiciously based on a thorough understanding of the situation and relevant legal and ethical standards. Question 2. Strategic planning requires a certified trauma professional (CTP) to accurately assess the risk posed by a client's trauma symptoms. A client reports experiencing frequent, distressing, intrusive thoughts related to a past traumatic event. They also describe actively avoiding situations, people, and places that remind them of the event, and report feeling constantly on edge, easily startled, and having difficulty sleeping. Which of the following risk assessment approaches best guides the CTP in developing an effective intervention plan? Option A. Assess the severity of the intrusive thoughts in isolation, recommending that the client simply try to suppress them to regain control over their emotional state. Option B. Directly explore the triggers for the intrusive thoughts and the specific avoidance behaviors, assessing how these symptoms are impacting the client's daily functioning and overall safety. To inform a phased intervention strategy, Option C. Focus primarily on teaching the client relaxation techniques to manage the hyperarousal symptoms, as this will indirectly reduce the intensity of intrusive thoughts and the need for avoidance. Option D. Prioritize immediate reduction of intrusive thoughts through cognitive distraction exercises, assuming that alleviating these thoughts will naturally decrease avoidance and hyperarousal. The correct answer is B. Directly explore the triggers for the intrusive thoughts and the specific avoidance behaviors, assessing how these symptoms are impacting the client's daily functioning and overall safety, to inform a phased intervention strategy. Explanation. Scenario analysis. This scenario presents a professional challenge due to the subtle yet significant impact of intrusive thoughts and avoidance behaviors on a client's recovery trajectory. A certified trauma professional (CTP) must accurately assess the interplay of these symptoms, recognizing that while avoidance may seem like a coping mechanism, it often perpetuates hyperarousal and hinders processing. The risk assessment must be nuanced, considering not just the presence of symptoms but their functional impact and the client's readiness for intervention. Correct approach analysis. The correct approach involves a comprehensive risk assessment that directly addresses the client's reported intrusive thoughts and avoidance behaviors. This aligns with best professional practice by prioritizing a thorough understanding of the client's internal experience and its manifestation in external behaviors. By exploring the triggers for intrusive thoughts and the specific avoidance pattern, the CTP can identify the underlying fear and anxiety driving these symptoms. This detailed assessment is crucial for developing a tailored intervention plan that gradually exposes the client to feared stimuli in a safe and controlled manner, thereby reducing hyperarousal and facilitating trauma processing. This approach is ethically sound as it respects client autonomy by involving them in the assessment process and ensures interventions are evidence-based and client-centered. Incorrect approaches analysis. One incorrect approach fails to directly link the client's avoidance behaviors to their intrusive thoughts and hyperarousal. This superficial assessment overlooks the interconnectedness of these trauma symptoms, leading to an incomplete understanding of the client's distress. Ethically, this constitutes a failure to provide competent care, as it does not adequately address the core issues contributing to the client's suffering. Regulatory frameworks for trauma professionals emphasize the need for comprehensive assessments that consider the multifaceted nature of trauma responses. Another incorrect approach focuses solely on the intensity of intrusive thoughts without exploring the functional impact of avoidance. This neglects a critical component of trauma recovery, as avoidance often serves to maintain the trauma cycle. Professionally, this is a failure to apply a holistic understanding of trauma symptomatology. Ethically, it could lead to interventions that are not sufficiently targeted, potentially increasing client frustration and hindering progress. A third incorrect approach prioritizes immediate symptom reduction through distraction techniques without addressing the underlying triggers of intrusive thoughts and avoidance. While distraction can offer temporary relief, it does not facilitate long-term healing or the processing of traumatic memories. This approach is ethically questionable as it may be perceived as a form of symptom management rather than genuine therapeutic intervention. It also fails to meet the professional standard of care, which mandates interventions aimed at resolving the root causes of trauma symptoms. Professional reasoning. When faced with a client presenting with intrusive thoughts, avoidance, and hyperarousal, a CTP should employ a systematic risk assessment process. This process begins with active listening and empathetic engagement to build rapport and encourage disclosure. The next step involves a detailed exploration of the nature, frequency, and intensity of intrusive thoughts, including their content and associated distress. Simultaneously, CTP must investigate the specific avoidance behaviors, identifying what the client avoids and the perceived consequences of engaging with avoided stimuli. The assessment of hyperarousal should focus on physiological and emotional responses, noting triggers and patterns. The CTP should then synthesize this information to understand the functional relationship between these symptoms, identifying how avoidance perpetuates intrusive thoughts and hyperarousal. This comprehensive understanding informs the development of a phased treatment plan that may include psychoeducation, cognitive restructuring, exposure therapy, and skills building for emotional regulation, always prioritizing client safety and readiness for each stage of intervention. Question 3. The monitoring system demonstrates a pattern of increased physiological arousal and reported intrusive thoughts in a client recently exposed to a significant traumatic event. Which of the following assessment approaches best aligns with best practices for certified trauma professionals in this situation? Option A. Focus the assessment exclusively on the intrusive thoughts, as this is the most prominent symptom identified by the monitoring system, and address this symptom directly. Option B. Rely solely on the data from the monitoring system to confirm the presence of trauma-related distress and proceed with symptom management strategies. Option C. Conduct a comprehensive clinical interview to explore the nature of the traumatic event, the client's subjective experience, and a full range of trauma-related symptoms, utilizing standardized diagnostic criteria and assessment tools to establish a differential diagnosis. Option D. Immediately initiate treatment for post-traumatic stress disorder, PTSD, based on the monitoring system's alerts, as these symptoms are highly indicative of this diagnosis. The correct answer is C. Conduct a comprehensive clinical interview to explore the nature of the traumatic event, the client's subjective experience, and a full range of trauma-related symptoms, utilizing standardized diagnostic criteria and assessment tools to establish a differential diagnosis. Explanation. This scenario presents a professional challenge because it requires the certified trauma professional CTP to navigate the complexities of assessing a client who exhibits a constellation of symptoms that could align with multiple diagnostic categories, including but not limited to post-traumatic stress disorder, PTSD, and other trauma-related conditions, as well as potential co-occurring mental health disorders. The monitoring system's data, while informative, is not a substitute for a comprehensive clinical assessment. The CTP must exercise careful judgment to avoid premature conclusions, ensure client safety, and adhere to ethical and regulatory standards for accurate diagnosis and treatment planning. The correct approach represents best professional practice because it prioritizes a thorough, multifaceted assessment process that is foundational to ethical and effective trauma-informed care. This involves utilizing a range of assessment tools and techniques, including clinical interviews, standardized measures, and collateral information, to gather a complete picture of the client's experiences, symptoms, and functional impairments. This comprehensive evaluation ensures that the diagnosis is not solely based on initial observations or limited data, but rather on a robust understanding of the client's presentation. This aligns with the CTP's ethical obligation to provide competent and evidence-based services, ensuring that interventions are tailored to the individual's specific needs and diagnostic profile, thereby maximizing therapeutic benefit and minimizing the risk of misdiagnosis or inappropriate treatment. Adherence to established diagnostic criteria, e.g., DSM-5-TR, and best practice guidelines for trauma assessment is paramount. An incorrect approach that relies solely on the monitoring systems, alerts without further clinical investigation, is professionally unacceptable. This failure constitutes a breach of the CTP's duty of care, as it bypasses the essential process of direct client assessment and clinical judgment. Such an approach risks misinterpreting data, leading to an inaccurate diagnosis and potentially harmful or ineffective treatment. It also fails to acknowledge the nuanced nature of trauma symptomatology, which can be influenced by numerous factors beyond what a monitoring system can capture. Furthermore, it may violate ethical principles of client autonomy and informed consent, as the client's subjective experience and narrative are not adequately integrated into the diagnostic process. Another incorrect approach that focuses exclusively on the most prominent symptom identified by the monitoring system, without exploring other potential diagnostic considerations or the underlying trauma history, is also professionally unacceptable. This narrow focus can lead to a superficial diagnosis, overlooking critical co-occurring conditions or alternative explanations for the observed symptoms. It neglects the complexity of trauma sequelae, which often manifest in multifaceted ways. This approach fails to meet the standard of care for a comprehensive trauma assessment, which requires a broad differential diagnosis and a thorough exploration of the client's entire clinical presentation. A professional decision-making process for similar situations should begin with acknowledging the information provided by the monitoring system as a potential indicator, not a definitive diagnosis. The CTP should then initiate a comprehensive clinical assessment, which includes a detailed history of trauma exposure, a thorough symptom evaluation using validated instruments and clinical interviews, and an assessment of functional impairment. This process should also involve considering differential diagnoses and ruling out other potential contributing factors. Throughout the assessment, maintaining a client-centered, trauma-informed perspective is crucial, ensuring that the client feels safe, respected, and actively involved in the diagnostic process. Ethical guidelines and professional standards for trauma assessment should guide every step, ensuring accuracy, client well-being, and the development of an appropriate treatment plan. Question 4. Research into the treatment of complex trauma suggests that different theoretical models offer distinct perspectives on its etiology and intervention. A certified trauma professional, CTP, is working with a client who presents with a history of prolonged interpersonal trauma, exhibiting symptoms of dissociation, emotional dysregulation, and interpersonal difficulties. Considering the CTP's ethical obligations to provide evidence-based and client-centered care, which of the following approaches to theoretical modeling is most aligned with best professional practice? Option A. Prioritizing a neurobiological model to address the client's physiological responses to trauma, while acknowledging that cognitive and psychodynamic elements may be indirectly influenced. Option B. Integrating insights from psychodynamic, cognitive behavioral, and neurobiological models to develop a comprehensive and individualized treatment plan that addresses the multifaceted nature of the client's trauma experience. Option C. Emphasizing a psychodynamic approach to explore unconscious conflicts and early relational patterns as the primary drivers of the client's current symptoms. Option D. Adopting a cognitive behavioral framework to focus on identifying and modifying maladaptive thought patterns and behaviors that maintain the client's distress. The correct answer is A. Prioritizing a neurobiological model to address the client's physiological responses to trauma, while acknowledging that cognitive and psychodynamic elements may be indirectly influenced. Explanation. This scenario presents a professional challenge because a certified trauma professional, CTP, must select the most appropriate theoretical model to guide intervention for a client experiencing complex trauma symptoms. The challenge lies in understanding the nuances of each model and how they align with evidence-based practice and ethical guidelines for trauma treatment within the specified regulatory framework. Careful judgment is required to avoid misapplication of theory, which could lead to ineffective or even harmful interventions. The correct approach, focusing on integrating psychodynamic, cognitive behavioral, and neurobiological models, represents best professional practice because it acknowledges the multifaceted nature of trauma. This integrated approach aligns with current best practices in trauma-informed care, which emphasize a holistic understanding of how trauma impacts an individual's thoughts, emotions, behaviors, and physiological responses. Regulatory and ethical guidelines for CTPs typically mandate evidence-based interventions and a client-centered approach, which this integration supports by drawing from multiple validated theoretical perspectives to tailor treatment to individual needs. An incorrect approach that solely relies on a single theoretical model, such as exclusively psychodynamic or exclusively neurobiological, fails to provide a comprehensive treatment plan. A purely psychodynamic approach might overlook the immediate behavioral and cognitive coping mechanisms needed for stabilization, potentially leading to re-traumatization if not carefully managed. Inversely, a purely cognitive behavioral approach might not adequately address the underlying emotional processing and relational dynamics that are often central to complex trauma recovery. A purely neurobiological approach, while valuable for understanding physiological impacts, may not offer sufficient guidance on therapeutic dialogue, meaning-making, or behavioral change strategies. Each of these singular approaches risks violating ethical principles by not providing the most effective and comprehensive care possible, potentially falling short of the standard of care expected of a CTP. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting issues, history, and strengths. This assessment should inform the selection of theoretical models that best explain the client's experiences and guide intervention. A critical evaluation of the evidence base for different therapeutic modalities, considering their alignment with the client's cultural background and preferences, is essential. Professionals must remain open to integrating insights from various theoretical perspectives, recognizing that no single model is universally sufficient for all trauma presentations. Continuous professional development and consultation with peers are vital for refining this decision-making process and ensuring adherence to ethical and regulatory standards. Question 5. The audit findings indicate a need to strengthen the organization's capacity to mitigate the impact of trauma on its workforce. Which of the following approaches best aligns with the certified trauma professional's role in assessing and enhancing resilience factors and protective mechanisms? Option A. Conduct a comprehensive risk assessment specifically designed to identify existing individual and organizational resilience factors and protective mechanisms, and to pinpoint areas for enhancement. Option B. Advise management that individual resilience is an innate characteristic and not significantly influenced by the organizational environment. Option C. Implement a broad spectrum of general employee wellness initiatives without a specific focus on trauma-related resilience. Option D. Focus solely on quantifying the prevalence of reported trauma symptoms to establish a baseline for future intervention. The correct answer is A. Conduct a comprehensive risk assessment specifically designed to identify existing individual and organizational resilience factors and protective mechanisms, and to pinpoint areas for enhancement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified trauma professional CTP to move beyond simply identifying trauma symptoms and instead focus on proactive, systemic factors that mitigate the impact of trauma. The audit findings highlight a need to assess the organization's capacity to support individuals who have experienced trauma, which necessitates an understanding of resilience factors and protective mechanisms at both individual and organizational levels. This requires a nuanced approach that considers the interplay of personal strengths, social support, and environmental resources. Correct approach analysis. The correct approach involves conducting a comprehensive risk assessment that specifically targets the identification and enhancement of resilience factors and protective mechanisms. This aligns with best professional practice by adopting a strengths-based and preventative perspective. By focusing on what makes individuals and the organization more robust in the face of adversity, the CTP is not only addressing potential negative outcomes, but also fostering a more adaptive and supportive environment. This proactive stance is ethically sound, as it prioritizes well-being and aims to build capacity rather than solely react to crises. It also aligns with the spirit of professional development and organizational health, which are implicit in the CTP's role. Incorrect approaches analysis. One incorrect approach would be to solely focus on the prevalence of trauma symptoms identified in the audit. This is a reactive approach that fails to address the underlying systemic strengths or weaknesses that contribute to how individuals and the organization cope with trauma. It overlooks the crucial element of resilience and protective mechanisms, thus not fulfilling the mandate of enhancing overall well-being and preparedness. Ethically, this approach could be seen as insufficient, as it doesn't fully leverage the CTP's expertise in promoting positive adaptation. Another incorrect approach would be to implement generic stress management programs without a specific assessment of the organization's unique trauma-related risks and existing resilience factors. While stress management is beneficial, it may not adequately address the specific challenges posed by trauma or leverage the organization's existing protective mechanisms. This approach lacks the targeted, evidence-informed strategy required for effective trauma-informed practice and could lead to misallocation of resources. A third incorrect approach would be to assume that individual resilience is solely an internal trait and not influenced by organizational factors. This overlooks the significant impact of a supportive work environment, clear communication channels, and access to resources on an individual's ability to cope with and recover from trauma. This perspective is not aligned with a holistic understanding of resilience and fails to capitalize on organizational protective mechanisms. Professional reasoning. Professionals facing similar situations should employ a decision-making framework that prioritizes a thorough understanding of the specific context and the identified needs. This involves 1. Deconstructing the audit findings to pinpoint the core issues related to trauma impact. 2. Identifying the relevant professional competencies in this case, understanding resilience factors and protective mechanisms. 3. Evaluating potential approaches based on their alignment with best practices, ethical principles, and the specific requirements of the professional role. 4. Selecting the approach that is most proactive, strengths-based, and evidence-informed, ensuring it addresses both individual and systemic factors. Question 6. The performance metrics show a consistent pattern of clients reporting significant emotional distress following a variety of challenging life events. A certified trauma professional, CTP, is reviewing a case where a client describes intense feelings of fear and helplessness after experiencing a significant financial loss due to a market downturn, which has led to job insecurity. The CTP must determine if this situation meets the definition of trauma as per the CTP's regulatory framework and ethical guidelines. Which of the following best guides the CTP's assessment in this scenario? Option A. Focus on the severity of the financial loss and its impact on the client's lifestyle as the defining characteristic of trauma. Option B. Apply a broad, generalized definition of trauma that encompasses any significant life stressor causing emotional upset. Option C. Assess whether the client's experience involves exposure to actual or threatened death, serious injury, or sexual violence, and if the client's response includes intrusion symptoms, avoidance, negative alterations in cognition or mood, and marked alterations in arousal or reactivity. Option D. Consider the client's subjective report of distress as the primary indicator of trauma, regardless of the nature of the event or specific symptom clusters. The correct answer is C. Assess whether the client's experience involves exposure to actual or threatened death, serious injury, or sexual violence, and if the client's response includes intrusion symptoms, avoidance, negative alterations in cognition or mood, and marked alterations in arousal or reactivity. Explanation. This scenario is professionally challenging because it requires the certified trauma professional, CTP, to navigate the nuanced and often subjective nature of defining trauma within a specific regulatory context. The CTP must balance the client's subjective experience with objective diagnostic criteria and the ethical imperative to provide appropriate care, all while adhering to the specific guidelines of the CTP certification. The challenge lies in distinguishing between a distressing event and a diagnosable traumatic experience that warrants specific interventions. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that aligns with the established diagnostic framework for trauma, as likely outlined in the CTP's governing regulations and ethical codes. This involves considering the client's narrative, the nature of the event, and the presence of specific symptom clusters that meet diagnostic thresholds. This approach ensures that interventions are evidence-based and tailored to the client's actual needs, preventing misdiagnosis and inappropriate treatment, thereby upholding professional standards and client welfare. An incorrect approach that focuses solely on the client's subjective distress without considering the diagnostic criteria for trauma fails to adhere to professional standards. This could lead to mislabeling non-traumatic distress as trauma, potentially leading to unnecessary or ineffective interventions, and a delay in addressing the client's actual needs. Conversely, an approach that dismisses the client's distress because it doesn't fit a narrow definition of trauma ignores the subjective impact of events and can be invalidating, potentially damaging the therapeutic alliance and violating ethical principles of empathy and client-centered care. Another incorrect approach might be to apply a generalized definition of trauma without considering the specific nuances of the client's experience or the established diagnostic criteria, leading to an inaccurate assessment and potentially harmful treatment planning. Professionals should employ a decision-making framework that begins with active listening and empathic engagement to understand the client's experience. This is followed by a systematic assessment using validated tools and diagnostic criteria relevant to trauma. The CTP must then integrate the client's subjective report with objective findings, considering the specific regulatory and ethical guidelines governing their practice. This iterative process allows for accurate diagnosis, appropriate intervention planning, and ongoing evaluation of the client's progress, ensuring ethical and effective care. Question 7. Which approach would be most appropriate for a certified trauma professional to utilize when assessing a client who reports a history of prolonged, repeated exposure to interpersonal violence and neglect throughout childhood, resulting in pervasive difficulties with emotional regulation, self-identity, and interpersonal relationships? Option A. A diagnostic approach that prioritizes identifying a single, most impactful traumatic event from the client's history and bases the entire treatment plan on addressing that specific event. Option B. A diagnostic approach that categorizes all significant traumatic experiences as acute trauma, regardless of their duration or interpersonal context, and applies standardized interventions for single-incident trauma. Option C. A diagnostic approach that focuses primarily on the severity of the client's current emotional distress and symptoms, without extensive exploration of the temporal or relational aspects of their past traumatic experiences. Option D. A diagnostic approach that differentiates between acute trauma, characterized by a single overwhelming event, and chronic trauma, defined by ongoing stressors, while specifically considering the interpersonal nature and developmental impact of the client's experiences to identify complex trauma. Correct answer is D. A diagnostic approach that differentiates between acute trauma, characterized by a single overwhelming event, and chronic trauma, defined by ongoing stressors, while specifically considering the interpersonal nature and developmental impact of the client's experiences to identify complex trauma. Explanation. This scenario presents a professional challenge due to the nuanced presentation of trauma symptoms, requiring a clinician to differentiate between distinct trauma typologies to ensure appropriate and effective intervention. Mischaracterizing the trauma type can lead to misdiagnosis, ineffective treatment plans, and potentially re-traumatization of the client. The Certified Trauma Professional (CTP) certification emphasizes a deep understanding of these distinctions, grounded in established trauma-informed care principles and ethical guidelines that prioritize client well-being and evidence-based practice. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that considers the temporal and relational aspects of the traumatic experiences. This aligns with the CTP's mandate to apply knowledge of acute, chronic, and complex trauma to tailor interventions. Specifically, recognizing the prolonged, repeated nature of the stressors and the interpersonal context points towards complex trauma, necessitating interventions that address attachment, self-regulation, and relational deficits, which are often not the primary focus of interventions for acute trauma. This approach is ethically sound as it ensures the client receives the most appropriate and potentially beneficial care based on their unique trauma history and presentation, adhering to principles of beneficence and non-maleficence. An incorrect approach that focuses solely on the immediate distress, without considering the duration and interpersonal nature of the trauma, would fail to identify the underlying complex trauma. This could lead to interventions that are too superficial, addressing only the acute symptoms rather than the pervasive impact on the individual's development and functioning. Ethically, this represents a failure to provide adequate care and could be considered a breach of competence if the professional lacks the knowledge to differentiate these trauma types. Another incorrect approach that might overemphasize a single, isolated traumatic event, even if severe, would miss the cumulative impact of repeated interpersonal trauma, leading to an incomplete understanding of the client's challenges and an inappropriate treatment plan. This would violate the ethical obligation to conduct a thorough assessment and provide evidence-based interventions. Professionals should employ a decision-making framework that begins with a thorough history-taking, exploring the nature, duration, and context of traumatic experiences. This should be followed by an assessment of the client's current symptomatology and functional impairments. Crucially, the professional must then integrate this information with their understanding of trauma typologies, specifically considering whether the trauma was a single event, acute, prolonged and pervasive, chronic, or involved interpersonal harm, betrayal, and developmental disruption, complex. This comparative analysis allows for the selection of the most fitting diagnostic framework and subsequent treatment modality, ensuring ethical and effective client care. Question 8. The review process indicates that a certified trauma professional (CTP) is working with a client who presents with severe symptoms of post-traumatic stress disorder, including intrusive memories, avoidance behaviors, and significant emotional dysregulation. The CTP is experiencing increasing feelings of emotional exhaustion and a sense of being overwhelmed by the client's narrative. Which of the following approaches best reflects the CTP's professional responsibilities in this situation, adhering to the Certified Trauma Professional (CTP) regulatory framework? Option A. Engage in extensive self-disclosure of personal experiences with trauma to build rapport and normalize the client's feelings, even if it leads to personal emotional distress. Option B. Minimize exposure to the client's traumatic material by limiting session frequency and duration to protect personal emotional well-being. Option C. Focus exclusively on the client's immediate distress and symptoms, deferring any personal feelings of exhaustion to a later time when the client's acute needs are met. Option D. Systematically assess the client's psychological impact of trauma using validated instruments, while concurrently implementing personal self-care strategies and seeking regular supervision to manage potential secondary trauma. The correct answer is D. Systematically assess the client's psychological impact of trauma using validated instruments, while concurrently implementing personal self-care strategies and seeking regular supervision to manage potential secondary trauma. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified trauma professional, CTP, to navigate the complex interplay between a client's reported psychological impact of trauma and the potential for secondary trauma in the professional. The CTP must balance the ethical imperative to provide effective care with the professional responsibility to maintain boundaries and avoid vicarious traumatization, all within the established regulatory framework for CTPs. The challenge lies in accurately assessing the client's needs while simultaneously monitoring one's own emotional and psychological state. Correct approach analysis. The correct approach involves a systematic and evidence-based assessment of the client's psychological impact of trauma, utilizing validated tools and techniques. This aligns with the CTP's ethical obligations to provide competent and appropriate care, as mandated by professional standards and potentially by specific regulatory bodies governing mental health professionals. Though for this exam, we focus on CTP-specific guidelines. It also necessitates proactive self-care strategies and supervision to mitigate the risk of secondary trauma, ensuring the CTP's continued ability to provide effective services. This dual focus on client well-being and professional sustainability is paramount. Incorrect approaches analysis. One incorrect approach involves solely focusing on the client's immediate distress without acknowledging or addressing the potential for secondary trauma in the professional. This neglects the CTP's ethical duty to self-monitor and manage their own well-being, which is crucial for long-term effectiveness and preventing burnout. It could lead to compromised judgment and reduced efficacy in client care. Another incorrect approach is to prioritize the professional's comfort or avoidance of difficult emotions over the client's therapeutic needs. This is a failure to uphold the core principle of client-centered care and can result in the client feeling invalidated or unsupported, hindering the therapeutic process. It may also violate professional codes of conduct that emphasize the client's welfare as the primary concern. A third incorrect approach is to engage in excessive self-disclosure or to allow personal emotional reactions to unduly influence the therapeutic relationship. This blurs professional boundaries, can be detrimental to the client's progress by shifting the focus away from their needs, and increases the risk of the professional experiencing vicarious traumatization. It is a deviation from the professional standards expected of a CTP. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's presenting issues, utilizing appropriate diagnostic and assessment tools. Simultaneously, they must engage in ongoing self-reflection and self-care practices, including seeking supervision or consultation when necessary. This framework emphasizes a balanced approach, ensuring that client needs are met while maintaining professional integrity and personal well-being, in accordance with CTP ethical guidelines and best practices. Question 9. The analysis reveals a client presenting with hypervigilance, intrusive thoughts, and sleep disturbances following a recent traumatic event. The Certified Trauma Professional, CTP, is considering the client's physiological stress response, Which of the following best reflects a best practice approach to understanding the role of neurotransmitters and hormones in this client's presentation and guiding intervention? Option A. Prioritize addressing potential serotonin imbalances, as this neurotransmitter is primarily responsible for mood regulation, and recommend dietary changes and over-the-counter supplements known to boost serotonin levels. Option B. Focus on the potential dysregulation of cortisol and adrenaline, recognizing their roles in the acute stress response, and consider interventions that promote relaxation and grounding techniques to help regulate the sympathetic nervous system and reduce the impact of these hormones. Option C. Assume that the client's symptoms are solely due to a lack of serotonin and recommend immediate referral for pharmacological intervention to correct the presumed deficiency. Option D. Interpret the client's symptoms as a direct and irreversible consequence of elevated cortisol, suggesting that long-term psychotherapy will be ineffective in mitigating the physiological impact. The correct answer is B. Focus on the potential dysregulation of cortisol and adrenaline, recognizing their roles in the acute stress response, and consider interventions that promote relaxation and grounding techniques to help regulate the sympathetic nervous system and reduce the impact of these hormones. Explanation. The analysis reveals a scenario where a certified trauma professional, CTP, is presented with a client exhibiting significant physiological and psychological distress following a traumatic event. The challenge lies in accurately interpreting the interplay of neurotransmitters and hormones, specifically cortisol, adrenaline, and serotonin, to inform effective trauma intervention strategies. This requires a nuanced understanding of how these biochemicals are dysregulated by trauma and how interventions can aim to restore balance, all within the ethical and professional guidelines of the CTP certification. The correct approach involves a comprehensive assessment that considers the client's subjective experience alongside potential physiological indicators of stress response. This aligns with best professional practice by acknowledging the biopsychosocial model of trauma, where biological factors like neurotransmitter and hormone levels are intrinsically linked to psychological and social well-being. A CTP's role is to integrate this understanding into a holistic treatment plan, prioritizing interventions that support neurobiological regulation and symptom reduction, consistent with evidence-based trauma care principles. An incorrect approach would be to solely focus on one aspect of the neurobiological response without considering the broader clinical picture. For instance, attributing all symptoms to a single neurotransmitter or hormone without a thorough assessment would be a failure to adhere to best practices. Another incorrect approach would be to recommend interventions that are not evidence-based for trauma or that could potentially exacerbate the dysregulation of these neurochemicals, such as suggesting over-the-counter supplements without professional guidance or recommending stimulant use without a proper medical evaluation. Ethically, a CTP must operate within their scope of practice, which includes understanding the biological underpinnings of trauma, but not diagnosing or prescribing medical treatments. Professional decision-making in such situations requires a systematic process. First, conduct a thorough clinical assessment to understand the client's trauma history and current symptoms. Second, integrate knowledge of neurobiology, including the roles of cortisol, adrenaline, and serotonin in trauma response, to hypothesize potential dysregulations. Third, select evidence-based interventions that are known to support neurobiological recovery and psychological healing. Fourth, continuously monitor the client's progress and adjust the treatment plan as needed, always prioritizing client safety and well-being. This iterative process ensures that interventions are tailored, effective, and ethically sound. Question 10. Operational review demonstrates a certified trauma professional, CTP, is working with a client who reports significant difficulties in forming and maintaining healthy, intimate relationships, often experiencing intense feelings of distrust and a sense of not knowing who they truly are. The client's trauma history includes prolonged childhood neglect and emotional abuse. Considering the impact of trauma on self-concept and relationships, which of the following therapeutic approaches best aligns with best professional practice for a CTP? Option A. Guide the client in adopting a predetermined healthy identity framework and relational model that has proven effective for other individuals with similar trauma histories. Option B. Immediately focus on challenging and restructuring the client's maladaptive relational patterns and communication styles, as these are the primary drivers of their current difficulties. Option C. Encourage the client to externalize blame for their relational issues onto past perpetrators, thereby reducing their internal distress and fostering a sense of justification. Option D. Prioritize building a stable and coherent sense of self, fostering self-compassion and developing healthy coping mechanisms before addressing specific relational patterns and dynamics. Correct answer is D. Prioritize building a stable and coherent sense of self, fostering self-compassion and developing healthy coping mechanisms before addressing specific relational patterns and dynamics. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified trauma professional (CTP) to navigate the complex interplay between a client's trauma history, their developing sense of self, and their interpersonal relationships. The CTP must recognize that trauma can profoundly disrupt identity formation, leading to fragmented self-concept, difficulty with trust, and patterns of unhealthy relational dynamics. The challenge lies in distinguishing between a client's genuine identity exploration and maladaptive coping mechanisms stemming from trauma, while also respecting the client's autonomy and avoiding pathologizing their experiences. Careful judgment is required to ensure interventions are sensitive, evidence-based, and tailored to the individual's unique trauma narrative and its impact. Correct approach analysis. The correct approach emphasizes a phased, client-centered intervention that prioritizes safety, stabilization, and the development of a coherent self-narrative before delving into relational restructuring. This aligns with established trauma-informed care principles, which advocate for a gradual progression from addressing immediate safety and emotional regulation to exploring the deeper impacts of trauma on identity and relationships. By focusing on building a stable sense of self and fostering healthy coping mechanisms, the CTP creates a foundation upon which the client can then engage in more complex work around relational patterns. This approach respects the client's pace, acknowledges the potential for re-traumatization, and adheres to ethical guidelines that mandate competence and avoiding harm. The emphasis on self-concept precedes relational work because a fragmented or unstable sense of self often underpins difficulties in forming and maintaining healthy relationships. Incorrect approach is analysis. An approach that immediately focuses on altering relational patterns without first addressing the client's self-concept and stabilization is ethically problematic. This could lead to re-traumatization by overwhelming the client with relational demands before they have the internal resources to manage them. It fails to acknowledge that trauma often erodes self-worth and trust, making healthy relational engagement difficult. Such an approach could be seen as a violation of the principle of non-maleficence, as it risks causing further psychological distress. Another incorrect approach would be to solely focus on externalizing blame for relational difficulties without exploring the internal impact of trauma on the client's self-perception and relational schemas. While external factors can contribute, a trauma-informed perspective necessitates understanding how the internal experience of trauma shapes relational behaviors and expectations. This approach neglects the core tenet of trauma work, which is to help individuals integrate their experiences and understand their impact on their sense of self and their interactions with others. It risks reinforcing a victim narrative without empowering the client to develop agency. A third incorrect approach might involve imposing a predefined identity or relational model onto the client, rather than facilitating their own exploration and construction of self. This is a violation of client autonomy and can be deeply invalidating, especially for individuals whose identities have been disrupted by trauma. It fails to recognize the unique and personal nature of identity development and the importance of empowering the client to define their own sense of self and their relational needs. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's trauma history and its current impact on their self-concept and relationships. This assessment should be ongoing and inform the development of a phased treatment plan. The initial phase should focus on establishing safety, building rapport, and developing coping skills for emotional regulation. Once a degree of stabilization is achieved, the focus can shift to exploring the impact of trauma on identity, self-esteem, and core beliefs. Only then should interventions targeting relational patterns be introduced, ensuring they are integrated with the client's developing sense of self and are implemented at a pace that respects their capacity. Throughout the process, continuous ethical reflection is paramount, ensuring that interventions are client-centered, evidence-based, and promote the client's well-being and autonomy. Question 11. The assessment process reveals a client presenting with symptoms consistent with generalized anxiety disorder, major depressive disorder, and a moderate alcohol use disorder, all of which appear to be exacerbated by a history of childhood trauma. Which of the following approaches best aligns with current best practices and regulatory expectations for certified trauma professionals in addressing these co-occurring conditions? Option A. Focus primarily on treating the symptoms of generalized anxiety disorder, as this is the most immediately distressing symptom for the client, with the expectation that improvements in anxiety will indirectly lead to reductions in depression and substance use. Option B. Implement a phased approach, first addressing the alcohol use disorder with detoxification and abstinence, followed by treatment for anxiety and depression, and finally trauma-focused therapy. Option C. Refer the client to separate specialists for each condition, a psychiatrist for medication management of anxiety and depression, a substance abuse counselor for the alcohol use disorder, and a trauma therapist for past trauma, without a central coordinating case manager. Option D. Develop an integrated treatment plan that concurrently addresses the anxiety, depression, and alcohol use disorder, incorporating trauma-informed interventions throughout all phases of care, and collaboratively establishing treatment goals with the client. The correct answer is B. Implement a phased approach, first addressing the alcohol use disorder with detoxification and abstinence, followed by treatment for anxiety and depression, and finally trauma-focused therapy. Explanation. The assessment process reveals a complex presentation of co-occurring disorders, specifically anxiety, depression, and a substance use disorder. This scenario is professionally challenging because the interconnectedness of these conditions can complicate diagnosis, treatment planning, and intervention. Anxiety and depression can exacerbate substance use as individuals attempt to self-medicate symptoms, while substance use can worsen or mimic symptoms of anxiety and depression, creating a cyclical pattern. Effective intervention requires a comprehensive understanding of these interactions and adherence to established best practices and regulatory guidelines for integrated care. The correct approach represents best professional practice because it prioritizes a holistic and integrated treatment model. This aligns with the Certified Trauma Professional (CTP) framework, which emphasizes addressing the multifaceted needs of individuals impacted by trauma, including co-occurring mental health and substance use issues. Regulatory frameworks for mental health and substance use services often mandate or strongly encourage integrated care to improve client outcomes, reduce fragmentation of services, and ensure that all presenting problems are addressed concurrently. This approach respects the client's autonomy by involving them in the treatment planning process and ensures that interventions are evidence-based and tailored to their specific needs, thereby promoting recovery and reducing the risk of relapse. An incorrect approach that focuses solely on treating one disorder while neglecting the others is professionally unacceptable. This failure to provide comprehensive care can lead to treatment ineffectiveness, client frustration, and potential harm. For example, treating only the anxiety without addressing the underlying trauma or the substance use disorder may lead to continued substance use as a coping mechanism, or the anxiety symptoms may persist or worsen due to untreated depression. This fragmented approach violates ethical principles of beneficence and non-maleficence, as it fails to promote the client's well-being and may inadvertently cause harm by not addressing all contributing factors. Furthermore, depending on the specific jurisdiction's regulations governing mental health and substance use treatment, such a limited approach could be considered a violation of licensing standards or practice guidelines that mandate integrated or coordinated care for co-occurring disorders. Another incorrect approach that involves imposing a treatment plan without client collaboration is ethically unsound and often violates regulatory requirements for informed consent and client-centered care. This paternalistic approach disregards the client's lived experience and their right to participate in decisions about their own treatment. It can erode trust, reduce engagement, and lead to non-adherence. Ethically, it breaches the principle of respect for persons. Regulatory bodies often mandate that treatment plans be developed collaboratively with the client, ensuring they understand the rationale, potential benefits, and risks of proposed interventions. A professional decision-making process for similar situations should begin with a thorough biopsychosocial spiritual assessment that specifically screens for and evaluates anxiety, depression, and substance use disorders, as well as any underlying trauma. This assessment should be conducted using validated instruments and clinical interviews. Following the assessment, a multidisciplinary team approach, if available, should be utilized to discuss the findings and collaboratively develop an integrated treatment plan. This plan should prioritize interventions that address the interconnectedness of the disorders, such as trauma-informed cognitive behavioral therapy, motivational interviewing for substance use, and evidence-based treatments for anxiety and depression. Crucially, the client must be an active participant in the development and ongoing modification of this plan, ensuring their goals and preferences are incorporated. Regular reassessment and adjustment of the treatment plan based on the client's progress and evolving needs are essential. Adherence to the specific regulatory and ethical guidelines of the governing jurisdiction is paramount throughout this process. Question 12. During the evaluation of a new trauma-informed group therapy program for survivors of interpersonal violence, the facilitator is considering the most effective initial approach for the first few sessions. The primary goal is to foster a sense of safety and build trust among participants who have experienced significant betrayal and fear. Which of the following initial approaches best aligns with trauma-informed principles and promotes a secure therapeutic environment? Option A. Avoid any direct discussion of trauma-related content in the initial sessions, opting instead for general stress reduction activities to prevent any potential for triggering. Option B. Begin with psychoeducation on trauma's impact, introduce grounding and self-regulation techniques, and establish clear group guidelines for respectful interaction and confidentiality, gradually introducing opportunities for voluntary sharing as comfort levels increase. Option C. Focus exclusively on individual processing of trauma narratives within the group setting, with the facilitator acting as a primary intervener for each person's story. Option D. Immediately encourage participants to share their most impactful traumatic experiences to foster a sense of catharsis and mutual understanding from the outset. The correct answer is B. Begin with psychoeducation on trauma's impact, introduce grounding and self-regulation techniques, and establish clear group guidelines for respectful interaction and confidentiality, gradually introducing opportunities for voluntary sharing as comfort levels increase. Explanation. This scenario presents a common implementation challenge in trauma-informed group therapy, balancing the need for a safe and contained environment with the inherent unpredictability of trauma, survivors' emotional responses. The professional challenge lies in facilitating a group process that promotes healing and connection without re-traumatizing participants or overwhelming the facilitator. Careful judgment is required to assess individual and group dynamics, manage potential crises, and ensure adherence to ethical guidelines and best practices for trauma treatment. The correct approach represents best professional practice because it prioritizes a phased and structured introduction to group work, beginning with psychoeducation and skill building before delving into deeper sharing. This aligns with trauma-informed care principles, which emphasize safety, trustworthiness, choice, collaboration, and empowerment. By establishing a foundation of understanding and coping mechanisms, participants are better equipped to engage in potentially vulnerable sharing. This approach also allows for ongoing assessment of readiness and provides opportunities for individual support, thereby minimizing the risk of re-traumatization. Ethical guidelines for trauma professionals underscore the importance of creating a safe therapeutic space and proceeding with caution when working with complex trauma. An incorrect approach that immediately encourages open sharing without adequate preparation fails to establish a safe container. This can lead to re-traumatization, as individuals may not have the necessary coping skills to manage intense emotions or disclosures. This violates the ethical principle of do no harm and disregards the foundational tenets of trauma-informed care, particularly safety and trustworthiness. Another incorrect approach that focuses solely on individual processing within the group setting misses the core benefit of group therapy, shared experience and mutual support. While individual processing is important, neglecting the group dynamic can isolate participants and hinder the development of a cohesive and healing community. This approach may also inadvertently create an environment where some individuals dominate the session, leaving others feeling unheard or overlooked, which is contrary to the principles of collaboration and empowerment. A third incorrect approach that avoids any discussion of trauma-specific issues due to fear of triggering participants would be overly restrictive and ultimately unhelpful. While caution is necessary, complete avoidance of the topic prevents participants from processing their experiences and can lead to stagnation in the therapeutic process. The goal is to facilitate safe exploration, not to eliminate all potential for distress, which is often a necessary part of healing. This approach fails to empower participants to confront and integrate their trauma. The professional decision-making process for similar situations should involve a thorough assessment of the group's readiness, a clear understanding of the therapeutic goals, and a commitment to ongoing ethical reflection. Professionals must be skilled in managing group dynamics, recognizing signs of distress, and adapting interventions as needed. Prioritizing safety, building trust, and empowering participants are paramount. This involves a continuous evaluation of the therapeutic alliance and the group's progress, ensuring that interventions are trauma-informed and ethically sound. Question 13. The evaluation methodology shows that a client presents with heightened vigilance, intrusive memories, and difficulty with emotional regulation following a traumatic event. Based on the understanding of brain structures involved in trauma response, which of the following assessment and intervention strategies would be most appropriate for a certified trauma professional to employ? Option A. Prioritize interventions that directly suppress the hippocampus's role in memory recall, as intrusive memories are the most significant symptom. Option B. Primarily address the client's fear response by implementing relaxation techniques aimed at calming the amygdala, assuming that this will resolve all trauma-related symptoms. Option C. Focus on identifying and mitigating the client's hyperarousal mediated by the amygdala, while also assessing the impact on memory consolidation by the hippocampus and the executive functioning of the prefrontal cortex to guide a multimodal intervention plan. Option D. Rely solely on the client's verbalized feelings of fear and anxiety without exploring behavioral manifestations or the potential for memory distortions. The correct answer is C. Focus on identifying and mitigating the client's hyperarousal mediated by the amygdala, while also assessing the impact on memory consolidation by the hippocampus and the executive functioning of the prefrontal cortex to guide a multimodal intervention plan. Explanation. This scenario presents a professional challenge because accurately assessing and intervening in trauma responses requires a nuanced understanding of complex neurobiological processes. The certified trauma professional, CTP, must integrate theoretical knowledge of brain structures involved in trauma with practical assessment skills, while adhering to the ethical and regulatory standards governing their practice. The challenge lies in distinguishing between typical stress responses and more severe trauma-related dysregulation, and in selecting interventions that are evidence-based and appropriate for the individual's presentation. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that considers the interplay of the amygdala, hippocampus, and prefrontal cortex in the individual's trauma response. This aligns with the CTP's ethical obligation to provide competent and individualized care, grounded in an understanding of trauma's neurobiological underpinnings. By focusing on observable behaviors, self-reported experiences, and the functional impact of these brain structures, the CTP can develop a targeted and effective intervention plan. This approach respects the client's autonomy and promotes healing by addressing the root of the distress. An incorrect approach that solely focuses on the amygdala's role in fear response, without considering the hippocampus's impact on memory consolidation or the prefrontal cortex's executive function, would be a regulatory and ethical failure. This would lead to an incomplete understanding of the trauma's impact, potentially resulting in misdiagnosis or the application of inappropriate interventions. For instance, an intervention solely aimed at reducing fear might neglect the memory processing deficits or executive dysfunction that are also critical components of the trauma response, thus failing to meet the client's holistic needs. Another incorrect approach that relies exclusively on self-report without considering behavioral indicators or the potential for dissociation would also be ethically problematic, as it could overlook crucial aspects of the trauma response and lead to an inaccurate assessment. This violates the principle of thorough assessment and could result in ineffective or even harmful interventions. The professional decision-making process for similar situations should involve a systematic approach. First, gathering information from multiple sources, self-report, behavioral observation, collateral information if available and appropriate. Second, integrating this information with knowledge of trauma's neurobiological impact, specifically considering how the amygdala, hippocampus, and prefrontal cortex might be functioning. Third, formulating hypotheses about the nature and severity of the trauma response. Fourth, selecting interventions that are evidence-based and tailored to the individual's specific needs and presentation, with ongoing monitoring and adjustment. This iterative process ensures that care remains client-centered, ethical, and effective. Question 14. The control framework reveals that a client presents with significant distress, intrusive memories, and avoidance behaviors following a recent traumatic event. The onset of these symptoms occurred within days of the event, and they are causing marked impairment in their social and occupational functioning. The certified trauma professional, CTP, must determine the most appropriate initial diagnostic consideration based on this presentation. Which of the following represents the most accurate impact assessment approach? Option A. Immediately diagnose an adjustment disorder, as any significant distress following a traumatic event can be categorized as such until further information is gathered. Option B. Conduct a thorough assessment of symptom duration, specific symptom clusters, intrusion, avoidance, negative alterations in cognition/mood, arousal/reactivity, and the temporal relationship between the traumatic event and symptom onset to differentiate between acute stress disorder, PTSD, and adjustment disorders. Option C. Prioritize a diagnosis of post-traumatic stress disorder, PTSD, due to the presence of intrusive memories and avoidance behaviors, assuming the duration criteria will eventually be met. Option D. Focus primarily on the client's subjective report of distress and the immediate impact of the event, without detailed symptom duration or specific diagnostic criteria, to ensure immediate emotional support. The correct answer is C. Prioritize a diagnosis of post-traumatic stress disorder, PTSD, due to the presence of intrusive memories and avoidance behaviors, assuming the duration criteria will eventually be met. Explanation. This scenario is professionally challenging because accurately differentiating between PTSD, acute stress disorder ASD, and adjustment disorders requires a nuanced understanding of symptom presentation, duration, and the individual's response to a traumatic event. Misdiagnosis can lead to inappropriate treatment, potentially exacerbating the client's distress or delaying effective intervention. The Certified Trauma Professional (CTP) designation implies a commitment to evidence-based practice and ethical client care, necessitating a rigorous impact assessment. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that considers the temporal relationship between the traumatic event and the onset of symptoms, the specific nature of the symptoms, e.g., intrusion, avoidance, negative alterations in cognition/mood, arousal/reactivity, and the severity of functional impairment. This aligns with diagnostic criteria outlined in established professional guidelines and ethical codes that mandate accurate assessment for effective treatment planning. It ensures that interventions are tailored to the specific disorder, maximizing the likelihood of positive outcomes and minimizing the risk of iatrogenic harm. An incorrect approach that focuses solely on the presence of distress without considering the temporal criteria or specific symptom clusters would fail to differentiate between ASD and adjustment disorders, or even a normal stress response. This is a regulatory and ethical failure, as it deviates from established diagnostic standards, potentially leading to misapplication of treatment modalities. Another incorrect approach that prematurely labels symptoms as PTSD without observing the required duration of symptoms post-trauma is also a significant failure. This prematurely assigns a diagnosis that carries specific treatment implications and stigma and can lead to inappropriate therapeutic interventions. An approach that neglects to consider the impact of the trauma on the individual's functioning, focusing only on symptom identification, is ethically problematic as it fails to capture the full scope of the client's experience and the need for support in regaining functional capacity. Professionals should employ a systematic decision-making process that begins with a thorough history, including details of the traumatic event and the client's pre-existing mental health. This is followed by a detailed symptom inventory, paying close attention to the timing of onset, duration, and severity. The impact of these symptoms on daily functioning is then assessed. Finally, this information is synthesized against established diagnostic criteria, such as those found in the DSM-5, to arrive at the most accurate diagnosis, guiding subsequent treatment planning. Question 15. Regulatory review indicates that a certified trauma professional is working with a client from a distinct cultural background, whose understanding of trauma and healing practices differs significantly from Western therapeutic models. The client expresses a desire to incorporate traditional healing rituals into their recovery process, which approach best aligns with regulatory requirements for culturally competent trauma care. Option A. Proceed with standard, evidence-based trauma interventions, as these are universally effective, and gently guide the client away from incorporating potentially non-standard healing rituals. Option B. Collaboratively explore the client's cultural understanding of trauma and healing, and integrate their preferred traditional practices into the treatment plan where clinically appropriate and safe, while ensuring evidence-based trauma interventions are also addressed. Option C. Acknowledge the client's cultural beliefs, but explain that traditional healing rituals are not recognized within the scope of certified trauma professional practice, and focus solely on established therapeutic modalities. Option D. Prioritize the professional's understanding of the most effective trauma treatment models, assuming that cultural practices can be addressed separately or are secondary to the core trauma work. The correct answer is B. Collaboratively explore the client's cultural understanding of trauma and healing, and integrate their preferred traditional practices into the treatment plan where clinically appropriate and safe, while ensuring evidence-based trauma interventions are also addressed. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a trauma professional to navigate the complex interplay between a client's deeply held cultural beliefs and the standard trauma treatment protocols. The challenge lies in ensuring that the treatment plan is both clinically effective and culturally sensitive, avoiding imposition of Western-centric therapeutic models that may be ineffective or even harmful. The professional must balance the need for evidence-based practice with respect for diverse worldviews, recognizing that a one-size-fits-all approach is inappropriate and unethical. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a collaborative and culturally informed assessment. This aligns with the ethical principles of autonomy and beneficence, as well as regulatory guidelines that emphasize culturally competent care. By actively seeking to understand the client's cultural framework, including their understanding of trauma, healing, and support systems, the professional can tailor interventions to be more relevant and acceptable. This approach respects the client's lived experience and empowers them in their healing journey, fostering trust and engagement, which are critical for successful trauma recovery. It acknowledges that cultural context is not merely an add-on but an integral component of effective trauma care. Incorrect approaches analysis. One incorrect approach fails by assuming that standard, culturally neutral trauma interventions are universally applicable. This represents a regulatory and ethical failure to provide culturally competent care, potentially violating guidelines that mandate sensitivity to diverse populations. It risks alienating the client, undermining therapeutic alliance, and leading to ineffective treatment due to a lack of cultural relevance. Another incorrect approach errs by prioritizing the professional's own cultural understanding or the perceived best, universal practice without adequate client input. This is ethically problematic as it disregards the client's autonomy and right to self-determination in their healing process. It can be seen as a form of cultural imposition, which is antithetical to trauma-informed care and may lead to re-traumatization or resistance to treatment. A further incorrect approach is to dismiss or minimize the client's cultural beliefs as irrelevant to trauma processing. This is a significant ethical and regulatory failure, as it demonstrates a profound lack of cultural humility and competence. It invalidates the client's experience and worldview, creating a barrier to trust and effective therapeutic engagement. Such an approach can lead to a superficial understanding of the client's distress and a failure to address the root causes of their trauma within their cultural context. Professional reasoning. Professionals should adopt a decision-making process that begins with a commitment to cultural humility. This involves recognizing the limits of one's own knowledge and actively seeking to learn from the client. The process should involve open-ended questioning, active listening, and a willingness to adapt treatment strategies based on the client's cultural background and preferences. Professionals must consult relevant ethical codes and regulatory guidelines pertaining to cultural competence and trauma care within their specific jurisdiction to ensure adherence to standards of practice. When in doubt, seeking consultation with colleagues or cultural liaisons experienced in working with similar populations is a crucial step. Question 16. The efficiency study reveals that a new client presenting with symptoms consistent with complex trauma is showing initial signs of engagement. the Certified Trauma Professional (CTP) is considering the most effective initial approach for psychoeducation and skill building. Option A. Begin with a comprehensive overview of the neurobiological impacts of trauma and introduce a range of coping skills immediately. Option B. Provide a brief, general explanation of trauma and then focus exclusively on teaching a variety of grounding techniques. Option C. Wait for the client to express specific questions about trauma before initiating any psychoeducational or skill-building interventions. Option D. Focus on establishing a strong therapeutic alliance and assessing the client's readiness and current capacity to process information before introducing specific psychoeducational content or skills. The correct answer is A. Begin with a comprehensive overview of the neurobiological impacts of trauma and introduce a range of coping skills immediately. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for psychoeducation with the ethical imperative of ensuring client readiness and autonomy. A certified trauma professional, CTP, must navigate the complexities of trauma recovery, recognizing that information delivery must be tailored to the individual's current capacity to process it. The correct approach represents best professional practice because it prioritizes a client-centered, phased intervention. By first assessing the client's readiness and establishing a foundation of safety and trust, the CTP ensures that psychoeducation and skill building are delivered in a way that is most likely to be absorbed and utilized effectively. This aligns with ethical guidelines that emphasize informed consent, client self-determination, and the principle of do no harm by avoiding overwhelming the client. The CTPs focus on building coping mechanisms before introducing more complex trauma-specific information is a hallmark of trauma-informed care, which is central to the CTP certification. An incorrect approach that immediately launches into detailed psychoeducation about trauma's neurobiological effects without assessing readiness fails to acknowledge the client's current state. This could lead to re-traumatization, increased anxiety, or a sense of being overwhelmed, violating the ethical duty to avoid harm. It bypasses the crucial step of establishing safety and rapport, which are prerequisites for effective therapeutic work. Another incorrect approach, focusing solely on skill building without contextualizing it through psychoeducation, might leave the client feeling like they are performing techniques without understanding their purpose or relevance to their trauma experience, hindering deeper integration and long-term benefit. This also neglects the client's right to understand their own experiences. A third incorrect approach, delaying all psychoeducation and skill building until the client explicitly requests it, might be overly passive and miss opportunities to proactively support the client's recovery journey, potentially prolonging their distress and not fully utilizing the CTP's expertise in guiding them toward healing. Professional decision-making in such situations requires a systematic approach. 1. Establish rapport and a safe therapeutic alliance. 2. Assess the client's current emotional and cognitive state, including their readiness to engage with trauma-related information. 3. Tailor psychoeducation and skill-building interventions to the client's identified needs and capacity, introducing concepts and techniques gradually. 4. Continuously monitor the client's response and adjust the pace and content of interventions accordingly. 5. Empower the client by explaining the rationale behind interventions and fostering their active participation in the recovery process. Question 17. Process analysis reveals that a certified trauma professional, CTP, is assessing a client who exhibits heightened vigilance, difficulty with emotional regulation, and impulsive decision-making following a recent traumatic event. The CTP needs to conduct a risk assessment. Which of the following approaches best integrates the neurobiology of trauma into this risk assessment process? Option A. Administering standardized risk assessment questionnaires without specific consideration for the neurobiological changes associated with trauma. Option B. Focusing primarily on the chronological sequence of past traumatic events to understand the origins of the client's current distress and potential risks. Option C. Evaluating the client's current physiological arousal levels and their impact on threat perception and impulse control, and then tailoring the risk assessment to these observed neurobiological responses. Option D. Prioritizing the immediate reduction of observable symptoms, assuming that symptom amelioration will inherently mitigate all associated risks. The correct answer is C. Evaluating the client's current physiological arousal levels and their impact on threat perception and impulse control, and then tailoring the risk assessment to these observed neurobiological responses. Explanation: this scenario is professionally challenging because it requires the certified trauma professional, CTP, to integrate complex neurobiological understanding of trauma with practical risk assessment in a way that is both ethically sound and aligned with the specific regulatory framework governing CTPs. The CTP must move beyond simply identifying symptoms to understanding the underlying biological mechanisms that contribute to risk behaviors and distress, while ensuring interventions are evidence-based and client-centered. The correct approach represents best professional practice because it directly addresses the neurobiological underpinnings of trauma-related risk by focusing on the client's current physiological and psychological state, and how this state influences their capacity for self-regulation and decision-making. This approach aligns with the CTP's ethical obligation to provide competent and evidence-based care, prioritizing client safety and well-being by understanding the biological basis of their responses. It emphasizes a holistic view, acknowledging that trauma can alter brain function, impacting areas responsible for threat detection, emotional regulation, and impulse control, thereby increasing vulnerability to certain risks. An incorrect approach that focuses solely on past traumatic events, without considering the current neurobiological impact, fails to adequately assess risk. This is a regulatory and ethical failure, because it neglects the dynamic nature of trauma's effects on the brain and nervous system, potentially leading to misinterpretations of current behavior and ineffective interventions. It also risks re-traumatizing the client by dwelling on past events without addressing present-day coping mechanisms or biological dysregulation. Another incorrect approach that relies on generalized risk assessment tools without incorporating neurobiological considerations is also professionally unacceptable. This represents a failure to adhere to best practices in trauma-informed care, which mandates an understanding of how trauma specifically impacts an individual's neurobiology, and consequently, their risk profile. Such an approach may overlook critical biological markers of distress or hyperarousal that are directly linked to increased risk. A further incorrect approach that prioritizes symptom reduction over understanding the neurobiological drivers of risk behaviors is ethically problematic. While symptom reduction is important, a CTP's role extends to understanding the why behind those symptoms, particularly when they manifest as risk. Ignoring the neurobiological context means interventions may be superficial and fail to address the root causes of the risk, potentially leading to relapse or the development of new maladaptive coping mechanisms. A professional decision-making process for similar situations should involve a multifaceted assessment that begins with a thorough understanding of the client's trauma history and its potential neurobiological sequelae. This includes evaluating current physiological arousal levels, emotional regulation capacities, and cognitive functioning. The CTP should then utilize this neurobiological understanding to inform a tailored risk assessment, identifying specific vulnerabilities and strengths. Interventions should be designed to address these neurobiological impacts, promoting self-regulation, resilience, and adaptive coping strategies, all within the ethical and regulatory boundaries of CTP practice. Question 18. Implementation of a phased approach to address a client's persistent intrusive thoughts and significant avoidance behaviors following a traumatic event. Which of the following best represents a best practice for a certified trauma professional? Option A. Focus solely on teaching coping mechanisms to manage avoidance without directly addressing the underlying intrusive thoughts. Option B. Encourage the client to suppress intrusive thoughts through distraction techniques and avoid any discussion of the traumatic event. Option C. Prioritize stabilization and psychoeducation, followed by gradual exposure and cognitive restructuring techniques to process traumatic memories and reduce symptom intensity. Option D. Immediately initiate intensive exposure therapy to confront and eliminate all intrusive thoughts, regardless of the client's current distress level. The correct answer is C. Prioritize stabilization and psychoeducation, followed by gradual exposure and cognitive restructuring techniques to process traumatic memories and reduce symptom intensity. Explanation: scenario analysis. This scenario presents a common challenge in trauma-informed care where a client exhibits symptoms of intrusive thoughts and avoidance, which are core manifestations of trauma. The professional must accurately assess these symptoms and implement interventions that are both effective and ethically sound, adhering strictly to the Certified Trauma Professional (CTP) framework. The challenge lies in distinguishing between normal distress and clinically significant trauma responses, and in selecting interventions that do not inadvertently re-traumatize the client or violate their autonomy. Correct approach analysis. The correct approach involves a comprehensive assessment of the intrusive thoughts and avoidance behaviors, exploring their triggers, intensity, and impact on the client's daily functioning. This is followed by the implementation of evidence-based trauma interventions, such as cognitive processing therapy, CPT, or eye movement desensitization and reprocessing, EMDR, which are specifically designed to address these symptoms by helping the client process traumatic memories and reduce their distress. This approach aligns with best practices by prioritizing client safety, evidence-based treatment, and a phased approach to trauma recovery, ensuring the client is not overwhelmed. The CTP framework emphasizes a thorough understanding of trauma's impact and the application of validated therapeutic modalities. Incorrect approaches analysis. One incorrect approach involves immediately attempting to confront and eliminate all intrusive thoughts without adequate preparation or stabilization. This violates ethical guidelines by potentially overwhelming the client, leading to increased distress and re-traumatization, which is contrary to the CTP's emphasis on a trauma-informed, phased approach. Another incorrect approach is to solely focus on avoidance strategies without addressing the underlying intrusive thoughts. While avoidance can provide temporary relief, it prevents the processing of trauma and can perpetuate the cycle of distress, failing to meet the therapeutic goals of trauma resolution. A third incorrect approach is to dismiss the client's intrusive thoughts as simply bad memories, without a thorough assessment of their traumatic origin and impact. This lacks the depth of understanding required by a certified trauma professional and can lead to misdiagnosis and inappropriate treatment, failing to acknowledge the specific nature of trauma responses. Professional reasoning. Professionals should first conduct a thorough assessment to understand the nature and impact of the intrusive thoughts and avoidance behaviors. This includes evaluating the client's current coping mechanisms and level of distress. Based on this assessment, a phased treatment plan should be developed, prioritizing stabilization and safety before engaging in trauma processing. Interventions should be evidence-based and tailored to the individual client's needs, with continuous monitoring of their response and adjustment of the treatment plan as necessary. Ethical considerations, such as informed consent and client autonomy, must guide every step of the process. Question 19. The assessment process reveals that a client who has experienced significant interpersonal trauma is expressing an urgent desire to engage in a behavior that, while seemingly a form of immediate relief, carries a high risk of negative consequences and potential re-traumatization. The client is insistent and resistant to exploring alternative coping strategies at this moment. Option A. Immediately allow the client to engage in the high-risk behavior, prioritizing their immediate expressed desire to avoid further distress and potential conflict. Option B. Contact a supervisor to determine the appropriate course of action without further discussion with the client, as the situation presents an immediate ethical quandary. Option C. Firmly refuse the client's request and insist they engage in pre-approved, safer coping mechanisms, explaining that their current emotional state makes them incapable of making sound decisions. Option D. Gently explore the underlying feelings and needs driving the urgent desire for this behavior, offering alternative, safer coping strategies, and collaboratively developing a plan to manage the immediate distress without engaging in the high-risk behavior. Correct answer is D. Gently explore the underlying feelings and needs driving the urgent desire for this behavior, offering alternative, safer coping strategies, and collaboratively developing a plan to manage the immediate distress without engaging in the high-risk behavior. Explanation. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for immediate, potentially harmful action and the trauma-informed principle of safety and empowerment. The professional must navigate this delicate balance, prioritizing the client's long-term well-being and autonomy while respecting their current distress. The core of the dilemma lies in recognizing that a client's immediate request may not align with their underlying needs or best interests, especially when influenced by trauma responses. The correct approach represents best professional practice by prioritizing the client's safety and empowerment through a collaborative, non-coercive process. This aligns with the core tenets of trauma-informed care, which emphasize building trust, fostering choice, and ensuring safety. By offering alternatives and exploring the underlying reasons for the client's request, the professional upholds the principle of respecting the client's agency while guiding them toward healthier coping mechanisms and solutions. This approach avoids re-traumatization by not imposing external solutions, but rather facilitating the client's own decision-making process. An incorrect approach that immediately accedes to the client's potentially harmful request fails to uphold the principle of safety. This could lead to further harm and undermine the therapeutic relationship, as it bypasses the opportunity to explore underlying issues and develop healthier coping strategies. It also neglects the professional's ethical responsibility to prevent harm. Another incorrect approach that dismisses the client's request without exploration or offering alternatives, while perhaps well-intentioned, can be perceived as invalidating and disempowering. This can erode trust and shut down communication, hindering the therapeutic process. It fails to acknowledge the client's distress and the potential validity of their feelings, even if their proposed action is problematic. A third incorrect approach that involves imposing a solution without client consent or collaboration violates the principle of empowerment and autonomy. This can be experienced as controlling and can trigger trauma responses related to a lack of control. It bypasses the client's right to self-determination and can damage the therapeutic alliance. Professional decision-making process for similar situations involves a continuous assessment of the client's safety and well-being, a commitment to the principles of trauma-informed care, safety, trustworthiness, choice, collaboration, empowerment, and a willingness to explore the underlying needs and motivations behind a client's expressed desires. It requires active listening, empathy, and the ability to offer a range of options that support the client's recovery and resilience. Question 20. System analysis indicates that a certified trauma professional (CTP) is working with a client who reports feeling constantly on edge, experiencing unexplained anxiety attacks, and having difficulty forming secure attachments, yet struggles to recall specific details of a past traumatic event. Considering the distinct ways trauma can impact memory systems, which of the following professional approaches best reflects an understanding of both implicit and explicit memory in trauma recovery? Option A. Assume the client's current distress is unrelated to the past event due to the lack of explicit memory recall and focus on general stress management techniques. Option B. Focus on therapeutic modalities that directly address somatic and emotional responses, recognizing that implicit memories of trauma may manifest without conscious recall. Option C. Primarily utilize cognitive restructuring techniques to challenge the client's current negative thought patterns, assuming these are solely the result of conscious interpretation rather than implicit memory encoding. Option D. Prioritize interventions that focus on detailed verbal recounting of the traumatic event to help the client consciously process and reframe their explicit memories. The correct answer is D. Prioritize interventions that focus on detailed verbal recounting of the traumatic event to help the client consciously process and reframe their explicit memories. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified trauma professional, CTP, to navigate the complex interplay between implicit and explicit memory in a client presenting with trauma symptoms. The CTP must differentiate how these memory systems are affected by trauma and how they manifest in client behavior and reporting, while adhering to the ethical and regulatory standards governing trauma-informed care within the specified jurisdiction. The challenge lies in accurately assessing the client's experience and developing an intervention strategy that respects the nuances of both conscious recall and unconscious processing of traumatic events, without re-traumatizing the client or misinterpreting their presentation. Correct approach analysis. The correct approach involves recognizing that trauma often impacts implicit memory more profoundly than explicit memory. Implicit memories are often nonverbal, somatic, and emotional, manifesting as physiological responses, emotional dysregulation, or behavioral patterns that the client may not consciously recall or understand. An effective CTP will prioritize interventions that address these implicit memory traces, such as somatic therapies, mindfulness, or EMDR, which work with the body and unconscious processing. This approach aligns with best professional practice by acknowledging the full spectrum of memory impacted by trauma, promoting a holistic and client-centered recovery process. It respects the client's lived experience, even when explicit recall is fragmented or absent, and adheres to ethical principles of beneficence and non-maleficence by avoiding approaches that might inadvertently trigger distress without adequate processing. Regulatory frameworks for CTPs emphasize evidence-based practices that acknowledge the neurobiological impact of trauma, including memory consolidation and retrieval processes. Incorrect approaches analysis. One incorrect approach would be to solely focus on eliciting explicit verbal recall of the traumatic event. This fails to acknowledge the significant impact of trauma on implicit memory. Ethically, this can be re-traumatizing if the client is pushed to recall details they cannot access or are not ready to process, violating the principle of non-maleficence. It also represents a failure to apply best practices by ignoring a crucial aspect of trauma's impact on memory, potentially leading to ineffective treatment and a lack of progress for the client. Another incorrect approach would be to dismiss the client's somatic or emotional responses as unrelated to the trauma if they cannot provide explicit verbal accounts. This misunderstands the nature of implicit memory, which is often expressed through the body and emotions. Professionally, this is a failure to conduct a comprehensive assessment and can lead to misdiagnosis or incomplete treatment planning. It also risks invalidating the client's experience, undermining the therapeutic alliance, and violating ethical standards of respect and dignity. A third incorrect approach might involve over-reliance on cognitive behavioral techniques that primarily target explicit memory and conscious thought processes, without integrating modalities that address implicit memory. While CBT can be a valuable component of trauma treatment, its exclusive application in the face of significant implicit memory disruption can be insufficient. This approach risks overlooking the root causes of the client's distress that are stored in implicit memory, leading to superficial symptom management rather than deep healing. It fails to meet the professional standard of providing comprehensive, trauma-informed care as expected of a CTP. Professional reasoning. When faced with a client presenting with trauma symptoms, a CTP should employ a phased approach to assessment and intervention. First, establish safety and rapport, creating a stable therapeutic environment. Second, assess the client's presentation, paying close attention to both verbal reports, explicit memory, and nonverbal cues, emotional states, and physiological responses, indicators of implicit memory. Third, select interventions that are tailored to the client's specific needs and the nature of their memory processing. This might involve a combination of therapies that address both explicit and implicit memory, such as trauma-focused cognitive processing therapy, TFCPT, for explicit recall and somatic experiencing, or EMDR for implicit memory processing. Continuous evaluation of the client's response and adjustment of the treatment plan are crucial, always prioritizing the client's well-being and adherence to ethical and regulatory guidelines.